Have you ever felt your chest tighten or your stomach drop during a conversation that had nothing to do with actually is happening right now? That reaction didn't come from your thoughts, it came from your body. And that's exactly what somatic therapy works with. Somatic therapy is a type of therapy that works with bodily sensations, movement, breath, and your nervous system, not just your thoughts and memories. Traditional talk therapy asks, what happened? And what do you think about it? Somatic therapy asks that too, but it also asks what's happening in your body right now as we talk about this. And a few approaches that you may have heard of fall under this umbrella. Somatic experiencing, developed by Peter Levine, focused on gently releasing stored survival stress responses. Sensory motor psychotherapy blends body awareness with traditional talk therapy, and TRE, or tension and trauma releasing exercises, uses guided physical tremoring to help the body discharge stress. So we're not going to go deep onto each one today. Just want you to know that they share the same core idea. The body holds information and healing it can happen through it. Now, here's the part that surprises people. Trauma responses, fight, flight, fawn, and freeze, aren't just psychological, they're physiological. Your nervous system reacts to danger automatically, often faster than your conscious mind can process what's happening. That's why when you can understand an event intellectually, so you can talk through it, analyze it, you can make peace with it in your head, and your body can still respond as if it's happening again to a tone of voice, a smell, certain kind of silence in a room, and suddenly your head is racing before you've even had a thought about why. So that gap between what you know and what your body still holds is what somatic therapy is designed to work with. Doesn't mean every symptom is trauma stored in the body. In some mystical sense, it means your nervous system can stay in a heightened or shut down state long after the danger has passed, and working with the body directly can help it recalibrate. So what actually happens in a session? It's usually much quieter than people expect and slower. So a somatic therapist might ask you to simply notice the sensation, tightness in your shoulders, a lump in your throat, without trying to fix or explain it right away. They might track small cues, a shift in your breathing, a clenched jaw, a foot that starts tapping. Sometimes they'll guide slow movements or breath work, or simply pause and ask, what do you notice right now? Crucially, this work happens in small increments, sometimes called titration, so you're never flooded all at once. You're not forced to relive your trauma in detail, and there's no requirement for touch. And you also stay in control of the pace the entire time. So if you've been nervous to try this because you're picturing something intense or overwhelming, that's not typically how it works. Somatic therapy is often used alongside treatment for PTSD, complex trauma, chronic anxiety, and long-term stress. It can be especially helpful if you've done years of talk therapy, understand your story intellectually, and still feel stuck, like your body hasn't caught up with what your mind already knows. That said, it's not a replacement for all mental health care, and it's not a right fit for everyone. So if you're dealing with severe dissociation or an acute crisis, it's worth discussing timing and approach with a licensed provider first. If this resonates, look for a licensed therapist with specific somatic training, credentials like SEP, Somatic Experiencing Practitioner, or certification in sensory motor psychotherapy are good signs. So directories like Psychology Today let you filter specifically for somatic therapy, which makes this a lot easier to search than it used to be. So, in one sentence, somatic therapy helps you process trauma through the body, not just the mind. That's it. If this was helpful, subscribe for more trauma informed content and let me know in the comments if you'd like a follow up video on somatic grounding exercise you can try at home. See you later.